thank you for coming. If those of you at the door would, I believe we're going to try and bring some more chairs over here. It's wonderful that you're all here this morning. And welcome. I am pleased to introduce Dr. Matthew Wynn, who's going to join us this morning. Dr. Wynn has extensive experience in clinical trials, clinical studies, research, papers. He's written all kinds of things regarding aging, the positive aspects of aging. And he's now in private practice, has his own private practice, helping adults as we journey through the process of aging. And something that I read about Dr. Wynn that I think is unique is that during graduate school, he lived, I believe, for 3 years in an independent senior complex. And think of how young he was, and he gained 24/7 firsthand experience with senior adults. And I think that because of his love for the age group and his experience, that he's going to provide us with some great information this morning. So welcome, Dr. Wynn. He's going to talk for about 45 minutes, and then we will open it up to questions. Thank you.
All right, thank you for that introduction. So my name's Matthew. I like to be here today to talk to all of you, but it's really special because I actually grew up in Lafayette. I went to Akalani's, Stanley, and Spring Hill, and so being back where I used to do some Boy Scout stuff is really nice. I heard there's going to be some Akalani's high schoolers coming through for some service a little later, so
About an hour after us, about 30 of us.
that's great. And like Sally was saying, right, I consider myself a geriatric psychologist, meaning in my private practice, 100% of my clients are over the age of 60. I think my youngest client is 61, everybody else is 70s or 80s. And I'll talk a little bit about older adult mental health today, but I really want to talk about this concept of sort of positive aging. And what does it mean to age? What does it mean to get old? What does it mean to feel old? I personally am 34, but I have 2 small kids and I feel very old sometimes. All right? I wake up and my neck hurts and I feel old. I know I'm not maybe objectively old by some of the standards that I'm going to talk about, but being old by societal standards and feeling old are 2 different things. And in my talk today, I'm really hoping to identify how positive or successful aging, and as well as sort of your feelings and conceptions about the aging process, both externally from others and sort of how do you feel about your own aging process, can be a barrier to positive aging, which again, I'm going to define a little bit better. Other things that can be that barrier are mental health concerns. Again, I'm a psychologist, so I think a lot about mood, worry, and just transitions. Specifically transitions that can happen at any age, but tend to happen more often as you get older. And the way that people either adjust or have a hard time adjusting to some of those, again, really normal transitions can have a bad effect on their mental health, but also make them really feel their age, really feel those negative conceptions that people have about the aging process and not those positive ones. And then I'll end with what everybody is probably here for and really cares about is sort of what can we do or what's being done to promote these concepts of positive aging. And I'll go through all of those both sort of at a societal level and at an individual level in more detail. Okay, so I'll start with just what am I talking about with positive or successful aging? How has this definition changed over the years? And aging, if you go put it into Google and you get maybe an AI definition, which you can trust or not trust, but it'll basically tell you that it's the accumulation of changes in a human being over time. That's at its base level what we're talking about with aging. And back in the day, I would say, for a very long time, those changes meant negative changes, meant decline. It really was talking about the accumulation of things that lead to our decline as a human being over time. And I think because that was sort of the definition, it led to a lot of negative views about the aging process. It was all centered on decline. Physical, mental, a slow march towards death. But more recently, and I guess recently is now 1998 or so, there was this movement to really try to redefine some of the aging process. Around here, there were like the Silver Panther movement. I'm not sure if anybody is familiar with the work of that. But this is successful aging, which is trying to say it's the process of growing old when you can still maintain a high level of physical, cognitive, or social well-being. That is an unfair standard. It kind of went too far in the other direction. It's saying if you can't, through modern, nutrition, exercise, and again, modern in the late 90s, if you can't maintain a high level of physical, cognitive, and social well-being, well, then you're not being successful in your aging process. It completely leaves out expected changes. So you use a cane, so things are a little slower, so a couple of your friends have passed or moved on. It doesn't mean you're not successfully aging just because you suffer or you can't maintain a high level of all three of these things. Again, these guys, Rowe and Kahn, for all the good work that they did, or the successful aging movement, went too far in the other direction, really over promoting only the positive aspects and really not talking about any of the negative changes that might come. And so these days, it's been redefined as positive aging, which is trying to hold both the positive and the negative. You acknowledge these negative conceptions, perhaps you expect some of them based on your family history, or you take a good look at yourself and you can kind of see where this is going. My hip is bad, it's been bad for a decade, I might need a cane in the next decade. And you also try to embrace the positive conceptions of aging at the same time. So it's not underselling or overselling one. This conception of positive aging, which again is a relatively newer way to think about things, is trying to hold both of these things in balance. And so what do I mean? What do I mean about these conceptions of aging? Well, here are some, and I'd encourage you to think about, well, when you think about growing older or aging process, what were you hoping for? Or what do you expect? What are the positive things that you hold about it? Here are some common ones that come up. Think about wisdom, right? When you get older, you're wise. You have some freedom from your job, freedom from your kids, freedom to do what you want, right? This is part of maybe what comes with retirement is a sense of freedom. Maybe you have a sense of family, either, friends who are family or kids, grandkids, great-grandkids. Tied in with freedom and family are these ideas of sort of legacy and accomplishments. Maybe you did a lot of good things at work. Maybe you're very proud of the way that you raised your family or the circle of friends that you've kept for, now 6 decades. And so you look back. Natural to think about your legacy and your accomplishments. And if you have things to look back on, well, that's a really positive, that's something I can't really do. I don't have a legacy yet. I have some accomplishments, but I don't have 6 decades of them to look back on. Perhaps you get some rest and hopefully you get some reverence. You get some good behavior from the younger generation, right? These are, again, if you're putting out the positive conceptions of what sort of the ideal older adult experience is, some people might cite these. Again, I encourage you to think of your own and what were you expecting as you got older? What were you looking forward to? And then the negative conceptions, and this list could go down all the way to the ground. They tend to be more, but it's decline. Again, that same idea that we talked about, physical decline, cognitive decline, whatever it might be. Maybe a loss of autonomy because of that decline. You can't drive yourself anymore, so there's a little bit of a lack of independence. Maybe you're lonely, maybe you're isolated. Again, if these family legacy accomplishments didn't go well, there might be a healthy amount of guilt and regret when you look back about paths not taken or decisions not made. Instead of reverence, you may get discrimination. I'm going to spend a little bit of time talking about ageism today. And really what we're talking about with aging is death, right? We're really talking about how much time sort of do I have left and what is it going to look like? And so when I talk about holding positive or negative conceptions of aging in some sort of balance, this is sort of my list. I really want you, I'm going to talk a lot about how these conceptions can actually affect our health and our well-being. And so think about which ones you hold, right? When you think about, I don't want to be old. Why not? What are you expecting that's going to go bad for you? When you say, I'm cool with being old, I like being older, why? What are you getting out of it? Okay. And so this is what I was alluding to a little bit at the beginning, right? This feeling old versus being old. And so the onset of old age is formally set by some society and cultural standards. They're a little bit arbitrary, they're a little bit inconsistent, and they're also culturally specific. I'm going to give you some examples. So you can make a Social Security claim somewhere between 62 and 70, I think, is when you're allowed, last I checked. Most people, when they claim Social Security, feel old. Or at least in the state, or according to the government, you are old, right? That is a bar you got to cross. In California, if you're over 60, you're an elder in their eyes. Whether or not you identify as an elder or an older person, as soon as you turn 60, you get protections from elder abuse, right? Adult Protective Services, or APS, now considers you old, whether or not you do. But 65 in other states. So all of a sudden you cross over, I can't remember the states, you cross over to a neighboring state, not old anymore, no longer an elder. You can kind of bounce back and forth and be elder or not elder, depending on what side you're on. For men and women, right, when you have menopause, when you have prostate exams, now these are considerably lower, but I guarantee when people first had these symptoms or first had to get a prostate exam or something, you probably felt old. Or at least, again, your doctor considered you old enough to have some conversations with you. And AMC is setting their own standard, right? I think over 60, you get to be a senior at AMC movies. And so again, whether or not when you walk in at 61 or 62, you feel old or you consider yourself old, AMC considers you old, and you're maybe willing to take that, judgment, take that label for a discounted ticket. And so these are right all over the place. And so these are some of the objective standards for when companies or the state or an expert, a professional might consider you all old. But that really, really differs from sort of this subjective onset of old age. When do you consider yourself old? And this is really, really arbitrary and inconsistent. It can fluctuate day by day. When you wake up and have that pain like I was talking about, or I have a crick in my neck, I feel old in the morning. I'm doing something later, I'm not thinking about it, maybe I'm playing some tennis or some pickleball, I feel great. It changes hour to hour, activity by activity, how much you are really sort of considering yourself old and thinking about those positive and negative conceptions. And so this can, and I'm actually going to switch through some of the ageism stuff real quick, but this leads to stereotyping, both towards other people and towards yourself, whether you consider yourself old or whether somebody else considers you old. And so ageism is a little bit stronger than some of these conceptions. And this is a little bit of a side road, but I promise I'll get back to what I was talking about in a second. And this ageism is a type of discrimination that involves treating people differently based on their age. It most often occurs sort of against the old, but again, it can occur in all sorts of directions. Old sort of against young, young against young. Ageism just has to do with age, although everybody stereotypically thinks about it as against the old. And this is the point I really want to bring up about ageism, is it's fundamentally different than a lot of the other forms of discrimination. You think about racism or sexism, you are born into that outgroup, more or less. You are born a woman, you are born black, but you're not born old. And that's one of these outgroups that you actually transition into. And for that, you're not born, but you will belong to it. It creates a really interesting thing where, unlike in some of those other groups where you're born into it and you get stigmatized or marginalized since birth, you might actually get some coping strategies for that. Maybe somebody else, an older person in your outgroup, will teach you. How do you navigate the world? A business, let's say, as a woman, right? Maybe an older female mentor grabs somebody on early on and say, hey, there's gonna be some discrimination here, but here's how you might wanna go through it. As much as you all might try to grab the younger generation and tell them what it's gonna be like when you're older, they're not gonna listen, no offense. And you don't necessarily wanna talk about that all the time. And so it's really hard for people who are younger to develop sort of coping strategies to deal with ageism when they're older. And so then when you get older and you don't have these coping strategies, I'm saying you very generally, I don't mean any specific person doesn't have any, but when you might lack some of these strategies, you're sort of unprepared to resist these negative age stereotypes. They're going to hit with full force because you really are experiencing them for the first time. And so you will very much internalize these examples of ageism. It can be very common for people, again, to say, I feel old today, and I don't like that. And I'm going to do things specifically so I don't feel old. And I'm going to skip through this part of ageism because I don't have quite enough time for it. But this internalized ageism, not between people, is sort of against yourself, resisting your own aging process, or at least emphasizing those negative conceptions that I showed versus the positive ones, can have real effects on older adult physical and mental health. So there's a study out there where they followed 500 people, age 50 and older, and they followed them for 20 years. So from 50 to their 70s. And they were asked these questions about their self-perceptions of aging, those positive and negative conceptions. And so participants who generally associated the things like wisdom and freedom and legacy with aging, at baseline, they had better health metrics over all of those 2 decades. And on average, lived about 7.5 years longer than the people who, when you asked them at 50, how do you feel about the aging process, tended to focus more on decline, guilt, those negative conceptions, like I said. And this is a separate study, and this one takes some explaining, so bear with me. On the bottom here is sort of years from baseline to their first cardiovascular event. So from when the study started, did they have a heart attack? And this study started when people were in their 20s. So this is 0 is when people are age 20, and 40 down at the end is when people are aged, 60. And so it's asking, basically, did that 20-year-old have a heart attack at 20? Did they have a heart attack at 30? Did they have a heart attack at 40? And if they did, the line goes up, right? This is the percentage with a cardiovascular event, a heart attack. And so you can see they split it between people who held, again, at their 20s. If they're asking these Akalani's kids who are coming in about, if I quiz them on their negative and positive stereotypes about aging, well, none of them are going to have heart attacks very soon because they're in their 20s. So you can see both of these are very similar. But once they get older, the people who, when they were young, held these negative stereotypes about aging were 3 times more likely to have bad cardiovascular health when they were in their 60s. It becomes a sort of self-fulfilling prophecy. If you are very negative about how you're going to age and about getting old in general, the studies show that you're much more likely to have a hard aging process. You're going to experience those heart issues, physical decline, cognitive decline, compared to people who are, again, a little bit more balanced or a little bit more positive about their own conceptions of the aging process. And you might ask, well, why? Well, how does this actually come out? And it's because those with low self-perceptions of age tend to view their health problems as inevitable, right? I'm not excited about my aging process. I don't want to get old, but I'm going to get old, and so why should I do anything about it? And so they're less likely to go to get their heart checked out, because they're less likely to get that prostate exam, because going to get it makes them feel old, something they hate, and so they'd rather just not go to their doctor and have that information thrown in their face. Taking, lots of medication is something older people tend to do. So if you don't want to feel old, don't take medication, and you won't have to live that life every morning and every evening. And so this is how this prophecy can really become self-fulfilling. People, start to isolate a little bit from the things that make them feel their age, even when those things are really important to make that aging process easier to deal with. Similarly, again, on a social level, studies show that older adults with negative self-perceptions of age are less likely to connect with their fellow older adults. So this is one way that all of you are bucking this trend. But you might imagine somebody out there who says, I wanted to go see Matthew speak today, but boy, everyone in that room is going to be older. And if I go, that means I'm older and I don't want to feel old, so I'm out. My dad falls in this one. He tried to live in a nice independent senior community. He's in his 60s. He plays tennis a lot. But when he got there, he went, oh no, everybody here is old. And I go, yeah. And so, again, I gave this a similar talk in Rossmore, right? People who could really benefit from moving to a place like Rossmore sometimes won't because that's where old people live and I don't want to be old. And so you can see, again, how some of these negative stereotypes that you might hold about the aging process towards yourself can really impact your behavior or might impact people's behavior in a way that's going to make that whole process a lot worse. So what are they doing about it? Okay, so this is what I think is really interesting. We're really trying to combat ageism across all these levels, both a societal level, try to help the young kids see old people as cool, but also internalized, help people deal with sort of their own self-stigma. And so one way that we're doing it is through intergenerational exposure. So this is the program actually that Sally was talking about. So I participated in an intergenerational exposure program by living in one of those independent senior communities for 3 years. I think over here they started a program in Berkeley called Home Match, where older adults with like an extra room because their kids moved out could have a Berkeley college student or graduate student, live in their spare room and I believe it's usually these intergenerational, you gotta kind of up the ante to get everybody involved. So usually there's some, reduced rent in exchange for a couple hours a week doing chores or doing something. That's how mine was. Mine was reduced rent, free to live in this older adult community for 3 years in exchange for 10 hours of programming and work, which in St. Louis, you throw on the Cardinals game and then bring a 6-pack of Budweiser, you'll have 20 older adults there for 2 hours, and that counts. And it was great. It just became hanging out with my friends. I really loved that time in my life. So there's also trying to do education. So this is an example. I'm trying to educate all of you, but there are podcasts about this. There are, other people who are really trying to talk about stereotypes and ageism, both external in society and internal, sort of within yourself. And then some people, if they're really having a hard time, might go, see a therapist to talk through some of their aging feelings. And so this is a bad example, I would say. The Golden Bachelor came up recently. This is one that's trying to say, hey, older adults are sexy and they're out there, right? But it went, again, too far in the positive direction. It ended up becoming sort of a caricature of people who maybe aren't real older adults. But it is an attempt, right? This is somebody's attempt to reduce ageism sort of in, globally. Grace and Frankie is maybe a better example. There are other shows that I'm sort of drawing a blank on. There's one with Ted Danson where he's in a retirement home. I'm not sure if people have seen that one, Inside Man or something. Also great. So there are maybe better attempts than The Golden Bachelor, but this is one way that people are sort of in the media trying to reduce ageism. I mentioned the Home Match program. And here are some websites. I'm not going to go to them today, but these slides also will just be, available to everybody. I'll make sure that Sally and Jamie have them, so you're all welcome to have them and click through on your own. I know I skipped some stuff today. But these are just other things, some of those podcasts that I was talking about, how are we reimagining aging, how are we kind of reconceptualizing death. Okay. Okay, well, so let me take a step back because I was a little disorganized getting started. And so this talk is about promoting positive aging. And mostly what I just talked about was negative aging and what can happen when things go bad. And I'm going to keep talking about what can happen when things go bad, but I'm going to go really quickly because these are just what we consider sort of barriers to positive aging. Positive aging being this idea that you can hold both, some of the positive and some of the negative. One barrier to that is if you're only holding negative, or when you're really emphasizing the negative, what can go badly for your health and mental health. These are other ways that your mental health can kind of take a turn when you are aging, and I want to point out some of the ways that they're different, or tend to be different for older adults than they are for younger adults. I'm going to go through these really, really quickly, 5 minutes or less, because I want to go to the strategies. What are what can you all do to sort of promote positive aging within yourself? Because that tends to be what people are more interested in. So there are these common causes of mental health issues. They can be biological. You can get depression really quickly if your neurons are literally depressed because you're not getting enough sleep or medication, or because your brain's not working quite like it used to because of a dementia or some other biological process. But I'm more interested in sort of situational depression or situational anxiety, which come up with life changes. And these are ones, again, they can happen at any stage of life, but they really tend to increase in frequency as people get older. Talking about the loss of a person, of a place, of an ability. Talking about a role transition, maybe from spouse to caregiver, maybe from workaholic to retired. Anytime there's a major role transition like that, it takes a lot of adjustment and can sometimes have a negative effect on your mental health. Talking about financial stress, loneliness or isolation, feeling disconnected from your fellow human beings, or uncertainty. And this can be uncertainty about the future. And that could be sort of your future or the future, like the country or your life. It can be, there's lots of uncertainty. Again, my life is very uncertain, but I tend to think about it less. Older adults with the uncertainty, especially about the future, tend to think about it more, just by way of what being closer to the end of their life has to do. I could talk a lot about death and sort of its effect on us, but that's not the point of this talk necessarily. But thinking about the uncertainty about the future, about the country, about these sorts of things are thoughts that really tend to ramp up as people get older. And sometimes that can cause depression. And so these are the 9 symptoms of depression. If you meet for 5 of them, you could get diagnosed. But my point in showing these is not to diagnose anybody, but to say that these can come in sort of waves and bit by bit. You could experience 2 of them, you could experience 3 of them, and you could still be feeling sort of the weight of depression or mental health issues. I'm just going to go through them because I'm going to highlight some of the differences for older adults. They're depressed mood, loss of interest or pleasure, significant weight loss or gain or appetite changes, sleep disturbance, psychomotor changes like going too fast or going too slow, tiredness, fatigue, low energy, a sense of worthlessness, excessive, inappropriate guilt, impaired ability to think, concentrate, and make decisions, or recurrent thoughts of death or self-harm. And I'll say most people, when they think about depression, think about the bottom one and they think about the top one, and maybe the top 2. I'm sad, I don't want to do things, and I think about death. But one of the reasons I put this up is you could just be not sleeping well, feel a little stuck in mud, be low energy, be eating a little bit more, and that counts. Those all count. You don't necessarily have to feel sad to be depressed, and I know that's kind of a strange concept, and that's in fact how depressed older adults tend to report. Compared to younger adults, they're less likely to endorse mood-related symptoms. You might feel okay, but if you're still sort of carrying the weight of one of those situational changes, things just might be a little slower, a little harder, be depressed in ways that are different from how you might usually think about them. They're also less likely to discuss their symptoms with friends or family, and they're less likely to receive formal treatment. I say they're less likely. Again, I am talking about stereotypically all of you, but I want to make clear I don't prescribe any of this to all of you. You might be discussing your symptoms all the time, currently receiving treatment. You might be sad if you're depressed. Just because these are the general trends and differences between older and younger adults, please do not make a mistake by saying I'm thinking that it applies to each and every one of you. And depressed older adults are more likely to report those cognitive changes, physical symptoms, something, loss of interest, something that we call sort of somatic depression. They're more likely to sort of feel the weight of the depression rather than the sadness itself. You're also more likely to attribute these symptoms to regular aging, just say, hey, it's part of the game. And you're most likely to think about death and actually attempt self-harm. And this is the one thing I wanted to get to because it's kind of a bummer and I apologize, but the most successful demographic in committing suicide is men over 65. It is not that talked about or reported, but it's something that really stuck with me when I heard it in graduate school and tends to be. And so just wanted to share that fact with everybody. I apologize. Okay, so then I'm going to skip through some of the anxiety stuff because anxiety has a lot of overlap, and we can really just think about it as worry. Worry that goes out of control. And compared to younger adults, older adults, the nature of their worry is often different. It tends to be for younger adults about school or work, things that might not exist for the older adult. And older adults tend to be, again, more worried about sort of bigger things like life and loss. That uncertainty about the future tends to be the biggest driver of worry among older adults. They also might, again, be more sort of past-focused worries, regret, things I didn't do, or future-focused, end of life and uncertainty. Younger adults tend to be more present-focused in their worry. What's going to happen today? I'm worried about how this friend thinks about me, or this test coming up, or this deadline at work. And older adults really tend to be used to it. This is one I've heard many, many times. I've always been a worrier, so it's really no different. And that might be true, but some of the coping strategies that people might have used might get less effective as they get older. So they're always a worrier, yes, but those worries are having a bigger effect on their day-to-day life. And then lastly, adjustment disorder, which is my most commonly given diagnosis, I'd say, in my practice, is just people who are having a little bit of trouble with one particular event. It's not full-blown depression, it's not full-blown anxiety. They have some mood symptoms, some worry symptoms, but it really is in direct sort of adjustment to a medical diagnosis, a cognitive diagnosis, retirement, moving out of your house, a hospitalization, a transition into a caregiver role, a loss of ability, a loss of a person, or maybe your kids have moved away and you're missing them. These are probably the most common adjustments that older adults tend to go through that affect their mental health and are worth talking to somebody about. Okay. So, what can we do to promote some cognitive and mental health within us? What can we do to really try to set ourselves up to age successfully, even if aging positively still means taking some balance with those negative and positive conceptions? Well, you probably have heard several of these before. If any of you have been to your doctor recently, they've told you to do, I'm guessing, at least some of these, or said good job if you're already doing them. Exercise, diet, sleep, cognitive activity, social activity, managing your mood, and maybe taking some medication. These are sort of the big seven of brain health and older adult health in general. Again, how many of you have gone to the doctor and they've told you to either great job with one of these or you need to do better on one of these? Everybody? Yeah. Okay. And so what does that mean? Well, what should you be doing? The best exercise for older adults is the most important part of my talk. Everyone always wants this answer. Does anybody have a guess?
What do you like to do?
Correct. Whichever one that you will stick with, whatever you will actually do. If you hate swimming and somebody tells you you've got to get in the pool, it is just the best cardiovascular exercise. Not for me. I hate swimming. I might do it once or twice. I might recognize the benefit. But if I don't like it enough to make it a habit, it's not a good exercise for me. Really anything that's within your capabilities, that gets your heart pumping a little bit, and that most importantly, you like, or at least have some friends that are going to force you to do it, is the one that is best for you. These include things I heard, right? Walking, cycling, swimming, tai chi, chair yoga, regular yoga, lifting weights, whatever. Tennis, pickleball, and most anything that is good for your heart is good for your brain. And the magical thing about this big seven is that they are so interrelated. If you can really maximize your time by combining a lot of these. If you go on a walk with some friends, you've now done exercise and social activity. If that really makes you feel good and you spend a little bit of time reflecting on sort of the gratitude you have for having a friend that you've had for so long and promotes that positive conception of aging, you've also taken care of your mood, you've worked on your own self-stereotypes. That can really be an amazing activity, something as simple as a walk, because you combine it with so many other things. And so that's going to be the key here. It's not really one specific activity. It's figuring out ways that work for you to check as many of these boxes as possible. So that's exercise. Here's diet. People always get mad if I give the same answer for diet. Is eat whatever you want, whatever makes you feel good, because that's not quite the same as exercise. General thinking is that Mediterranean diet or DASH diet, they're very similar but have minor differences, tend to be the best for brain health. If anybody sees a neurologist and is worried about their their cognitive health, they're likely to tell you to change your diet in this way. These are good guidelines, but again, I would say if you hate fish, seafood, nuts, and legumes, something they tell you to eat at least 3 servings a week, and by trying to keep it up, you're just gonna end up driving to Wendy's and sneaking hamburgers because you can't take it anymore, it's not a good diet for you. And so trending towards these things, trending in this direction with enough treats and other things to sort of satisfy your own mental health and make it a habit that you're willing to keep is a really good way to do it. I've heard of some older adults who are sort of putting together a dinner potluck, or I guess a round robin, maybe hosting, where somebody has to make a Mediterranean or a dash dish, once a month or something like that, and it rotates through. And again, a good way maybe to check off multiple boxes. Get something good for your diet, connect with friends socially, do something that's good for your mood. Okay, behavior modification, a quick note here because it's hard. I'm a psychologist. This is a lot of what psychologists have been doing forever. Ever since, Skinner was putting pigeons in a box and having them tap for reward, we're trying to change behavior. We're trying to understand why people do what they do. And changing to a new diet or an exercise routine is really, really hard. And it seems like it should be so easy. I talk to a lot of my clients about what's called the Nike strategy. Does anybody know the Nike slogan for a really long time? Just do it. And that's what they say. I can do it, I just need to do it. And this just is carrying so much weight in that sentence because it's really not so easy, as anybody who's ever tried to do a diet or exercise New Year's resolution can attest to. And that's because we are bad at it. And decades of behavioral research say that if you set small goals, small expectations for things that are fun or meaningful, and you give it consistent effort, even if not consistent results, if you do these things for 6 months, a year, you will develop a habit. But that is very hard because when people say, I want to go to the gym, they don't want to go 1 day a week with an expectation that I might be there for 30 minutes because that seems way too small and I just need to do it. I just need to go every day. Well, that's going to be really hard. If you're going from 0 times a week to 5 days a week, that's a humongous jump that people are really not very good at recognizing. And so I really encourage people, if you're trying to eat a little bit healthier or do an exercise, wherever you are, add 1 day or 1 meal or 1 workout to start. Give that consistent effort for a week, and if you're doing a great job, bump it up 1 more time. Bump it up to 2. And if you try harder things that you don't really want to do, it's just going to be more likely to fall by the wayside. Okay. Sleep comes up a lot. It's one of these reversible causes of cognitive decline. If your sleep is really, really bad, you can actually experience mild cognitive impairment, and such that if you get your sleep apnea or your sleep fixed and you start to sleep better, your brain power comes back. And so it's often something, again, if you show up in a neurology clinic and are complaining and you sleep horribly or have sleep apnea, it's one of those first things they're going to tell you to get assessed and get fixed. Unfortunately, it is so annoying to get assessed. Has anybody done an in-person sleep study? It's like the worst sleep of your life.
The study isn't what's awful. What's awful is the CPAP.
Also, exactly. So the getting it assessed, where you have to go in, get hooked up to all this stuff, and they tell you to sleep normally in a place that's totally foreign, is also very difficult and annoying. And then the treatment they give you back is a Darth Vader mask that you have to wear every day. It's, for people who have done it, again, it works. It can really, really help. But it is something that, in theory, should be easy. Everyone's telling me, get it assessed, get it treated. In reality, it's a lot harder than that. It's really annoying. And so again, your doctor's gonna say you have to wear this every night. If you're wearing it 0 nights a week, start with 1 night a week and give that consistent effort for a couple of weeks. Because if at the end of 6 months, you're wearing it consistently, it doesn't really matter if you started on day 1 wearing it consistently and have done it for 6 months, or if you started really, really small and worked your way up to consistent at 6 months. At that 6-month follow-up, all your doctor is going to care about is that you're using it more than you were. And there are other things you can do for your sleep, what's called sleep hygiene. And so I'm going to, again, go through these a little quickly, but these are things that some people work specifically with a counselor or a psychologist to try to get better at. These are things I am terrible. This is my own personal confession. I have horrible sleep hygiene. I do not have regular go to bed and wake up times. I eat in bed. I watch my phone in bed. It is not for sleeping only. But these are things that if you really, again, work on them, they've been research proven to improve your sleep. And so regular go to bed and wake up times, right? Even if I don't fall asleep, I'm going to try to go to bed at 10 p.m. every night. I'm not going to watch TV until I fall asleep, which who knows when that could be, and then go to bed at whatever time it happens to be then. I'm really going to try to wake up and go to bed times. Bed is for sleeping only, with the exception of some intimate activities. It is for sleeping only. No eating, no watching TV, no reading maybe gets a pass because it's so light and not that cognitively stimulating. But again, if you're really having trouble sleeping, it's important to send signals to your brain that sleep is about to come. If you think, this is experience for me, again, I have small children. If you think about how you taught your kids to sleep, there was a whole routine that told their brain, starting 30, 45 minutes before, sleep is coming, sleep is coming, sleep is coming. And that's so their brain could release the necessary chemicals to fall asleep. Many people these days, again, myself included, are hoping that their brain can recognize when it's time really, really quickly. They are not giving themselves any runway whatsoever. And so one way you do that is, if your bed is only for sleep, and you've really been strict about that, then as you approach it, your brain will recognize it and say, oh, okay, bed is coming, sleep is coming, start to release those chemicals. Other things that help with that are the sleep ritual, right? And people do stretching, people do, a warm cup of tea, people do some reading. It really doesn't matter what it is, but again, if you give yourself a little routine from about 30 minutes before your go to bed time, you do these things consistently, you can train your brain to recognize sleep is coming. And because I'm having my tea, I know I'm going to be in bed in about 25 minutes. That is a really, really helpful routine to improve sleep. And the most important thing I would say is to really limit blue light, and that's phone most importantly. So again, I'm terrible at this, but if you're on your phone in bed and separately you don't think you sleep very good, they are very connected and should be probably the first thing you try to put your phone somewhere else instead of in bed. Again, this is available. I have more handouts about sleep hygiene specifically. I could give probably a whole talk on improving sleep, and this is something that people work with professionals for, because again, it's just not so easy. Okay, cognitive activity. Similar to exercise, the best cognitive activity. People always ask, Sudoku, crosswords, whatever. It's the same as exercises, whichever one you will stick with. All of these are great. Crossword puzzles, Sudoku, brain training games, but also things that are less formal than that. Just having in-depth discussions with friends about current events, planning travel and having to figure out where my hotel is, what my flight is going to be, plotting the most efficient route at the grocery store. All of these things are cognitively stimulating. Writing your list in such a way that you're going to go straight down the list and on a perfect S route through and just get everything so quickly. Anytime you're really engaged with an activity, so you're using your planning, decision making, those types of skills, cognitive skills, counts. You don't have to sort of trick yourself into using those things by doing crossword puzzles. Unless, of course, you love crossword puzzles, in which case, go crazy. The research basically shows that not one of these things is going to be so strong as to completely curtail dementia or cognitive decline. But again, part of what I'm hoping to instill here is by combining many of these together, you can really achieve some big things. And so if you plan travel with friends, that does the social. If you plan a travel that has, even if the travel is just a hike, there's exercise, right? If you can put some of these together, so being by yourself, doing a crossword puzzle by yourself, if you hate crossword puzzles, isn't really going to do much for you. If you're comparing your score on crossword puzzles or Wordle or anything like that with your kids or with your friends and you get competitive and there's a social aspect to it, that's going to be a lot better than doing one of these activities sort of that you don't like by yourself. There is, again, some evidence for improved brain health from these activities by themselves, but it's really hard to decouple from these other factors. Again, are these things good because they're really good for you, or are they good because they're helping you check some of those other boxes? I think it is both. Okay, and then social activity. This one is very important. Research has shown that social isolation or loneliness in older adults comes with a 50% increased risk of dementia, 30% increased risk of heart attack or stroke, and just a quarter risk of dying earlier than somebody who is not socially isolated or lonely. And so this is one, again, that can affect anybody for normal reasons, because people move away, people pass away, things happen. Older adults are a particularly vulnerable group for social isolation and loneliness. Probably not all of you, because you are all here today. You have this wonderful community organization in this church, but it exists, and maybe some of you. And so social activity comes along with a lot of these activities, and it's not something that ever really occurs by itself. If somebody comes over to hang out or you go to do something with them, you're probably doing exercise, cognitive activity, you're having food together that affects your diet, right? It really is really tied in, but it is probably the most important one, because again, if you're trying to change some of these other behaviors, having a buddy or a group system to help reinforce and push you out can really, really help create habits. And so if you feel like you just don't have friends or family that you can push to do these things with you, I would really recommend telling somebody that, trying to connect, talking to somebody about it, because being socially isolated or lonely is a really hard place to get out of and can be really, really bad. And luckily there are lots of people out there in the world who love nothing more than to hang out. And so it's also one of those with some effort and some connections, has a lot of resources to combat it. Older adult isolation has been known about in this sort of serious way for 20, 30 years. And again, a lot of social programs, church or community have sprung up in that time to really prevent it. Okay. So this is my own personal plug, is for breathing, mindfulness, and meditation. And these things can be so good for your mental health and for promoting positive aging. But people are so scared of doing them because I think they really only think about meditation. They really only think, when I say, have you ever tried mindfulness or breathing? They say, well, I meditated one time in the 70s, but it didn't really do anything for me. Or I tried that recently. My kid gave me an app, but again, I couldn't turn my brain off, is probably the most common phrase that I hear from people. It didn't work. I sat, but I couldn't turn my brain off. And that's the point of some meditations, but that is one type of the things that I'm talking about. There are so many other types of meditations or mindful activities or really breathing that you don't have to turn your brain off. They don't have to be 30 minutes. You don't even have to be sitting down. These are things that I really work with people on and really stress that you can do in a couple of minutes that can have really big effects. So one is breathing. Just taking a deep breath. A single deep breath can be extraordinary for managing stress and mood. I do it all the time. When I get stressed out, I just go. And that was great. But it takes skill to realize that you're getting stressed out and take that big breath. It's really easy when you're stressed out to just keep chugging through. And so I would recommend sometimes that people do what's called a box breath in the morning to practice their breathing. A box breath, if you imagine 4 sides to a box, just trying to key you in on sort of the 4 components to this. It's breathing in, holding that breath and being full, breathing out, holding that emptiness and being out. And then you breathe in and you hold it and you breathe out and you hold it and you make a little box. And you can do that. I think the video that I usually use is 4 seconds on each side. That's 16 seconds, let's call it 15 seconds. There's 4 of those in a minute. You take 8 box breaths in 2 minutes. And that's what I recommend a lot of people do every morning. Just sit, and it takes literally 120 seconds or 2 minutes. You take 8 deep breaths and you're off to the races. Research has shown that can really have a calming effect and carry with you through the rest of your day. And when people say, I don't want to get into meditation because I don't have time, this is like the most basic version of it. It's so sort of straightforward and low time commitment. It also might have the least effect, but it's easy to do. And you can also do mindfulness in a whole other type of way. Mindfulness really just means bringing your attention to the present moment. in whatever way that means to you. And so I like to do a sensory mindfulness where I try to lock into what my sensory experience, that is what I see, what I hear, what I smell, what I taste, what I can touch, for a minute. And so again, if I'm feeling stressed out or I'm recommending this to a client, I'll say, take 2 minutes, take a breath, and what do you see? Let's see, well, I see a lot of people, but I'm going to try not to describe anybody. So I see a clock back there, and it's 11:06, and I am behind, and it has maybe black or brown around it, and I'm just sort of describing what it is. Then I'll stop. I hear somebody talking outside, and just kind of key into what do I see, what do I hear, take some deep breaths. Again, do that for 30 seconds, 2 minutes, 5 minutes if you're really liking it. And these are things that research has shown that's you being mindful. My favorite mindfulness, I don't think I put it here actually, is social mindfulness. I described it earlier. So when you're out on a walk with a friend or when you're having something like this, isn't this so nice? You turn to your friend, you're my friend. This is great. And people sometimes do that, but sometimes don't, because, well, it seems a little bit weird. But again, bringing awareness or mindful attention to your present moment and how maybe grateful you are for what you're getting to do, how much you like this person, or how good the food is, whatever it might be, can boost those positive conceptions of aging that I talked about all the way at the beginning. And that sort of gratitude or social mindfulness exercise can really, again, prevent a lot of the negative declines that we talked about today. And so this is something when people talk about, I don't know how to do meditation, you might not, but I know all of you know how to breathe and how to bring attention to whatever is happening right in front of you. And so these are things that I would recommend people try to pepper into their life. Meditation, here are some apps. Again, if you have the slides, you can look it up, but don't want to talk about that right now. Okay, and then the last thing is just professional services. So for all the things I talked about, if people are feeling a little out of whack, not positively aging, feeling the weight of their negative conceptions of age or the transition that they're going through, their mood or their worry is getting out of whack, professional services can be really, really helpful. Obviously, informal services, your church, your community, your friends, your family, these are all excellent ways too. But if it's just not working, talking to someone can help. And older adults might face barriers to this. They might not be appropriate specialists, right? I consider myself a geriatric psychologist. There aren't very many of us in the Bay Area who really fashion themselves in that way. You may want a geriatrician, not a primary care physician, but if anybody's tried to make that switch recently, you know that they're full and have big, big waiting lists. Same with geriatric psychiatrists who might actually prescribe the right medications for your mood or worry that don't play badly with your other medications. So finding appropriate specialists is hard. I really recommend that everybody does, or if they're on the fence about their current provider and you're thinking about making a switch anyway, make a switch into somebody who specializes in geriatric issues. It can make a big difference, but be ready that there might not be that many. Medications that have limited side effects, again, that can be great. Medications can, but you might be taking a lot, and so you got to find a geriatric psychiatrist who can do one, give you prescriptions in a way that aren't going to mess badly with what you're already taking. And then there are generational issues. I have some clients who are men who this is their first ever experience with the mental health system. And it took a lot of poking and prodding from their spouse and kids to get them in the door with me. And that's not to say that the men in here are shy about talking about their emotions or are sensitive, but just generationally, older men were raised in a way that talking to a psychologist about their mood is not necessarily something that they've ever thought about doing before or are interested in doing. That extends to older adults actually in general. They're, again, less likely to seek out help for some of the issues that they might be having. But if people do, it can get a little confusing. So the last thing I have is just sort of an informational slide about the different people you might talk to, because the terminology can get confusing sometimes. So you might talk to a primary care physician. They're going to spend more time prescribing and adjusting your medication, which they can do, although if they're not specialized in it, your mileage may vary in terms of how helpful they are. They're often less specialized than a psychiatrist in terms of this prescription, but they're really a lot easier to access. I would guess almost everybody in here has a primary care physician. Contrast that to the right with a psychiatrist. They're going to spend more time prescribing again and adjusting. And these are some of the things that they might prescribe. These are really common mood, worry, adjustment issue medications. Lexapro, Prozac, buspirone. Again, part of me showing this is trying to normalize the taking of anti-anxiety or antidepressant medication if they're helpful for you. Again, people try them and the side effects aren't good. People try them and they don't work. I'm not talking to you if they don't work, but if they might work and you might be open to it, it's worth a try. And that contrasts with a licensed counselor and psychologist who can't prescribe. I can't prescribe any of these drugs, and so for that reason I'll typically spend more time in sort of talk therapy, working through somebody's adjustment issue. And I might be doing something like behavioral activation or life review or reminiscence. And then that's a psychologist, which I am, is different than a neuropsychologist, which if you're having cognitive issues, you might want to see so that they can conduct a neuropsychological evaluation to see how your cognitive activity is doing compared to somebody who's average. So your primary care is probably giving you some brain tests. Maybe people have been asked to draw a clock sometime in the last 2 years. That's fine. If you're really worried about it, a specialist is probably the better way to go. Okay. So I know this talk is a little bit rambling, but I hope it kind of came together a little bit in terms of I really want to emphasize this idea of positive aging, or trying to hold sort of these conceptions of whether we feel old and how that makes us act, and really reflect on what are your positive or negative conceptions of aging. Do you want to be old? How often does I don't want to be old and I'm not going to do this thing as a result of it come up for your life? And what does it mean for you to sort of age well? Because having negative conceptions of aging and holding them very tightly is one of several barriers to sort of positive aging, right? This ageism that we hold, as well as sort of general depression, anxiety, and adjustment issues, can really get in the way of our aging well process. There are some things you can do to help out. I hope I convinced you of how to make some behavior change by starting small with things that actually you want to do or you like to do, because that's the way you're most likely to stick to it. And then mood, purpose, mindfulness, stuff like that in the psychology realm is probably the ones that are the hardest for people to tackle. It's probably the ones that your primary care physician will tell you to exercise, they'll tell you to diet. They might ask you if you're interested in antidepressant medication, but they're not going to really talk to you about your sense of purpose or your guilt or your regrets or your legacy or your accomplishment or some of these bigger issues. And so these things, when they come up at the end of life, can really throw a wrench in how people feel about themselves and how they're feeling in general, and they can be really hard to tackle. But that's why mental health professionals exist. Okay, that's all I had. I'm sorry I went so long, but I'm happy to take some questions.
Thank you. Thank you very much. That was quite enlightening. Let's take just a few minutes, and if we have some questions, I'll go around with the microphone and try and take them, and we'll probably limit this to probably 10 minutes.
Yeah, and I'll be around a little bit after
Okay.
people want to come up and say,
A couple of
hey.
questions.
Yeah. I have many questions.
One.
So I often wonder how in social sciences one distinguishes between cause and effect. And the second part is, have you considered asking people to probably take a small step, but let's say seeing a senior peer counselor, a volunteer, or a CC minister, just to kind of ramp up to something that's more serious? Yeah. I think that's I don't know more about it.
Sure. It's really hard. And I actually, Sally talked about some of my research at the very beginning. I'm out of the research game. I'm totally got burned out completely on difficulty in sort of teasing some of these things apart. And I think when you talk about cause and effect, it's just something that's a little bit easier to tease out in younger adults when there's less life experience that could be the cause. By the time you're talking about somebody who's in their 80s and has 8 decades of potential causes, really figuring out why this effect is happening gets so complicated. And so just my cop-out answer, no offense to your first question, is I don't think they do a very good job of it. And I think you might not need to know cause and effect. You can determine sort of your own through some trial and error. You can decide, if I do this, sort of, is it generally making me feel better? If I do this, what are those immediate sort of effects that I can notice, and you can do some sort of data collection and science on yourself is the way that I frame it for my clients. And then what you said about small step, absolutely. I would encourage anybody, if they think that talking to anybody could help, start with your daughter, start with your friend, start with your dog, start with anybody to get that feeling of kind of bringing it up to yourself, because that's the hardest part, is sort of, again, if I go talk to this person, that means I might have a problem. And if I don't talk to them, well, maybe I could take that thought I might have a problem and just put it way back there and try to never think about it. I think that's sometimes a good strategy, but often not. And so any minister, right, support, social worker, psychologist, anybody that you would feel comfortable with talking sort of seriously, because in my experience, almost anybody that you go to in that capacity, either if they're professional or informal, if they care about you at all, which most of them will, are going to respond with a lot of empathy, a lot of kindness, and a lot of support. They might not be able to fix whatever you're going through, but I truly, truly believe that just talking to somebody can really help.
I appreciate what you do, because most doctors are looking at babies because they'll success versus old people, which is it's an end game.
Newborn twins are probably the most studied people out in the world. No, there's not. And one of the reasons I ended up in St. Louis, it was a great time, was because it was one of a very few schools that had a specific gerontology track.